Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County. And today I'm joined by Lee Bartholomew, who is the Animal Control Officer for Douglas County, and really an amazing story of what gets done to control animal behavior and especially reduce the risk of rabies. So we'll be getting to Lee in just a few minutes, but as always, we'll start off with a discussion about what's happening with COVID. So COVID is very quiet right now. In the world, the number of cases are dropping. In the US, cases are very low. And in Douglas County, the cases are about as low as we've ever seen them. This week, we're averaging less than 2 cases per day, which is a very low number. And we have very few people in the hospital at this point. So really, COVID is generally much less of an issue now than it was even just a few weeks ago when we had over 20 cases per day. The big news in COVID is always the variants. You'll remember we had the Omicron variant in January, which was designated the BA1 variant. Now there's a BA2 variant that's circulating in Europe, it's circulating in New York and Washington, D.C., and we're starting to see a little spike in cases in New York and a little spike in cases in D.C. The cases have been relatively mild. There have not been a lot of hospitalizations and deaths associated with them, which is really good news. In Oregon, we're starting to see a little bit of BA2, especially in the Portland area and up in Corvallis. And we know that when there's disease in one part of the state, it will eventually spread down to Douglas County. So what we're expecting now is a low number of cases, at least for the next several weeks. But towards the end of April or in May, we might start to see another little small spike in cases. We might see a little bit of increase in hospitalizations too, but we're not expecting to see the huge spike like we saw with Delta or the huge spike that we saw with Omicron. The data still shows that the vaccines do work and they help to prevent disease, but really help to prevent hospitalizations and deaths. I looked at data today that looked at your risk of death is 15 times lower if you're fully up to date on your vaccines than if you're unvaccinated. And when we look at our deaths are overwhelmingly in the small percentage population who not getting any vaccines. So we have plenty of vaccines out there. If you want to get a vaccine, talk to your doctor or go over to Aviva. We've got plenty of vaccines. As far as getting a second booster, there is now an allowance to get a second booster. Second booster will give a slight increase in protection. I'm going to get mine today, and I'd encourage people who are over 50 or those with immunocompromising conditions to get it. The other two big pieces of news is that flu has been prominent in the last week. So actually, we've seen more cases of influenza in the last week than we have of COVID. So if you come down with a fever and a cough, you should get tested for COVID, but you should also get tested for flu. And the reason you should get tested for those is there are specific treatments now for both COVID and flu. They're both oral medications that you take twice a day for 5 days, and they really help to prevent hospitalizations and deaths. So if you're sick, get tested for flu and COVID. If you're positive for flu and COVID and are at high risk, ask your doctor about getting one of those antiviral medications. But overall, things have been very quiet with COVID, and we're glad to hear that. So let's talk with Lee about stuff. So Lee is our Animal Control Officer, and this is a fitting time to do it because this is Animal Control Officer Week. And so most people don't even know that we've got such a stellar animal control project. So Lee, how long you've been doing this, and tell us what you do in an average day.
I've been doing it for 31 and a half years. And on an average day, I put on probably 200 to 250 miles. And last year I had handled over 2,200 calls, which doesn't count the 12 for the phone calls and the follow-ups. That's just initial calls.
Wow, really a tremendous amount of work. And so when I look at the animal bites, the most common ones we see are from domestic animals, especially dogs, but we also see some cats. And as a provider, I certainly see kids who get bitten by a dog and sometimes get infections from those things. Tell us what we're doing with animals who are repeat biters or animals that are recurrent problems.
Well, if it's an unprovoked bite, like a dog runs across the street and bites somebody walking, something to that effect, then they're declared potentially dangerous on the first time, and any other menacing or bites deems them a dangerous dog, and then they are taken away at that time.
Okay. And about how many dog bites do you deal with in a year? It's a big number.
Yeah, dog bites in general, we deal with 350 to 400 probably a year. Dog bites are probably 200-ish of that.
And we worry about dog bites not only because they can give you local infection, but they can also give you rabies. And rabies is such a terrible disease that we never, ever want to see a case. So tell us about how much rabies we're seeing in dogs and cats.
Well, in dogs, we rarely see rabies unless they come up from Southern California or Mexico, somewhere like that. Actual Oregon dogs, we don't see rabies in because we do keep a pretty good amount of them vaccinated. Cats, on the other hand, most of them are not vaccinated, and they like to play with things like bats that are flopping around on the ground, and bats are our number one carrier of rabies.
And they are. So about a dozen times a year, we have a situation where somebody gets an encounter with a bat. And about 10% of the bats in Douglas County are positive for rabies. And so we just had one this week, and it was a fairly typical story. Somebody saw a bat inside, tried to pick it up and move it outside and got bitten. So what would be your recommendation for somebody who finds a bat in the house?
I'd say if they find a bat in the house, whether it's alive or dead, to leave it alone and call for us to come and pick it up so we can test it to make sure it's not rabid.
And that's really important. So if you find a bat, don't try. You don't have to be the hero and get rid of it, because there's a moderate chance that if you try to get it, you will get bitten or scratched. The reason we want to catch these bats is we want to check them for rabies. And the way we check them for rabies is kill them and look at their brains. And we want to check to see. And Lee and the other people working in animal control have been immunized against rabies. And so that even if this bat was rabid and got scratched, he's not going to get rabies because the rabies vaccine is so very effective. So again, you find a bat in the house, no need to be the hero. Leave it alone. They can live inside until the next morning when you can call Lee and he'll help to get rid of it. Bats are, except for rabies, generally not very dangerous, but rabies is a real concern because rabies has nearly 100% fatality if you get it. So what do we recommend if somebody does, for example, this person who got a bad exposure this week?
Well, because of the fact he did throw the bat outside and it disappeared, then we recommend that they start their rabies post-exposure vaccinations immediately.
Right. And this person did start. Now, people my age sort of remember the stories that rabies vaccine was a terrible vaccine that had injected into your belly. No longer. It's really just a regular vaccine that you get through a regular shot, but it's expensive, several $1,000s by the time you get this. So always best to prevent bad exposure rather than to treat it otherwise. So Lee, what other kind of animals do you deal with? We talk about rats, we talk about bats and cats and dogs, but you also deal with other bigger and other more dangerous animals.
I do. I do all the horse and cattle, livestock investigations. I also deal with exotic animals when they come up. If somebody has something exotic at their residence, then I have to go check on that. So basically, pretty much, I've dealt with everything from alligators to camels to everything in this county. So,
well, it really is an amazing story. Are you going to write a book?
You know, I keep getting told by people that I need to write a book because it's amazing the stuff that goes on.
Well, it really truly is. And we're blessed to have the wildlife safari here, and they clearly have their big animals. But it's amazing to me that people do have other kinds of exotic animals in almost every part of the world. So, well, thank you for talking to us today. Again, the information from that is If you have pets, please get them vaccinated against rabies. If you do happen to have an animal bite, please report that to animal control. And if you find a bat in your house, leave it there, give Lee a call, and they'll take care of it. If you do get scratched or bitten by a bat, even if it's a very minor scratch or bite, you do need to get that checked out. So Lee, what else would you add for us?
Well, I would add right now it's cat season. There are lots of feral cats out there, and a lot of them may be sick. And so if you see a sick or injured cat, again, don't try to pick it up to go get it treated or anything. Leave it there. Call the non-emergency sheriff's office line, and we'll come pick it up so that we can watch it to make sure it isn't sick, because they're probably the second most likely animal to get rabies in our county.
All right. Well, thank you so much for joining us today, and think more about writing that book. Again, This is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. We'll do this again next week. Thank you.
Thank you.